Hello, everyone. We are live on Facebook and on Instagram. Hi. Um, it is Wednesday, March 18th. So, good afternoon in Europe, good morning in America. Um, just a quick recap, another of our coronavirus updates. And today I want to talk to you about from listening to some of my colleagues who are out in the front lines. I see that there is a lot of people that are still not sure how to react. A lot of us start getting symptoms, and we immediately start thinking that it is coronavirus. So whether or not it is or not, I want to share with you today a couple of the differences between the types of symptoms that could be coronavirus and what to do if and when you get those symptoms. So the first thing to understand is that the symptoms that coronavirus infection has, the COVID or the coronavirus disease is presenting with, are very similar to what you would get with a regular cold or with the flu, right? So the most common symptoms are fevers, dry coughs, a sore throat, muscle fatigue, muscle aches. Those are the most common ones, but you can also have headaches and you can also have diarrhea. Now, here's the difference though. Keep in mind that we're also entering spring, so there are a lot of symptoms, a lot of conditions that might be associated more with seasonal allergies, such as runny nose, stuffy noses, and sneezes. Those symptoms, if you have a runny nose, if you have a stuffy nose, if you're sneezing a lot, if your cough is productive, meaning that it's got mucus, it is most likely not due to coronavirus infection. At least at first, okay? A coronavirus infection, if it gets bad, it can get to that point. So those are the things to consider and to keep in mind. Now, what should you do if you have these symptoms? Where the first thing that you need to realize is that the treatment, there's really no treatment for the infection. There's no real retroviral or anything. It's just symptomatic, which means that you will be treating your symptoms. You will be just making sure that you're comfortable. You'll be resting. You'll be at home, whether it is the flu or whether it is coronavirus. So those two are the same. Now, when should you actually seek out to go to the hospital? First and foremost, if you have respiratory distress, so if you are having difficulty breathing at any moment, you need to call 911 and call an ambulance or have somebody drive you to the ER. So don't wait for your doctor to get on the phone. Don't wait for their office to get on the phone. If you have difficulty breathing, regardless of whether you have any of the other symptoms or not, you need to go to the ER immediately, right away. Now, if you have fever, a dry cough, sore throat, let's say you've got muscle aches, but you do not have respiratory distress and you do not have any of other chronic conditions such as uncontrolled asthma or diabetes or COPD or cancer or anything along those lines, or an autoimmune disorder, then you probably don't need to go to the hospital. Here's what you need to do if you have those things. Call your doctor's office and ask to talk to someone there. Usually it is a mid-level, a nurse practitioner, a nurse, a triage nurse, or maybe even the doctor, or if you have access to any of these concierge practices or telemedicine practices, get an appointment over there, right? And talk to somebody, share your symptoms, share your specifics, because I cannot give 100% generalized recommendations. I can give generic recommendations because I don't know your exact medical history, but these will apply to most people. Okay, so keep that in mind when you have these symptoms. Do not just show up in your doctor's office. Don't just get in the car and go to your doctor's office because you think it might be coronavirus. And why should you not do this? Well, first and foremost, if you do have the virus, you may spread it to other patients in the office who have other conditions. Maybe there are patients there who have autoimmune disorders or have immunocompromised, or children, or somebody along those lines. If you have the virus and you just go to the office and you sit right next to them, you might spread the virus to them. On the other side, let's assume that you don't have the virus, but you go to your doctor's office regardless, and there are people there who do have the virus. Then you can catch it and you can bring it home and you can infect everyone at home. So keep those two things in mind before you go to your doctor's office. Now, I want to be very, very clear about this. This does not mean that you should ignore your symptoms and that you should not seek out medical care. Just do it over the phone, do it online, use telemedicine, and contact your healthcare provider before you leave your home and before you go to their office. All right. So a lot of the times you may have some of these symptoms. You just have a little bit of a fever. You have a little bit of muscle aches. You feel tired. Just try to stay at home. Try to control the fever before you take over the counter medication. Try to control it with drink a lot of fluids, stay calm, get in a bath, bring your temperature down. You might try some over the counter temperature control, fever control medications. That's about it. If it continues to get bad, call your doctor's office. Don't hesitate. But like I said, don't rush to the ER unless you have respiratory distress, and don't just show up in your doctor's office. Now, what should you do if you do have those symptoms but you're feeling fine, like I was saying? Well, let the people around you know as well. Hopefully you are at home. Hopefully you are you're not out there and you're spreading it everywhere, and the rest of your family is also at home. Keep in mind that incubation period can be for up to 2 weeks. So if you already start having symptoms, it means that you've had the virus for about a week and a half, a week, 2 weeks. So you have been spreading it around. Make sure that you let the people you've been in contact over the last week know about this, especially those living at home with you. If you are the only person in your household with the symptoms, try to stay as isolated as possible from the rest of them. Okay, you don't necessarily need to be in lockdown, but do try to avoid contact. Try to stay at least 3 feet away, which is 1 meter distance from the rest of the people there. Wear a mask. Extreme all the other precautions, washing your hand. If you're working at home, make sure that you're disinfecting your keyboard, your mouse, your pens, your notebooks, wherever you're sitting, the mug you're drinking out of, the water bottles you're drinking out of, the glasses you're drinking out of. If possible, get your own. Use one of the bathrooms just for yourself. Or for the person who has the symptoms, and everybody else use the other ones. And obviously, don't go outside. All right. I know that yesterday I recommended that if you're able, you don't have symptoms, and you can just go outside and you can get some sun, get some fresh air. If you have a patio, if you have a balcony, you can still do that. But just don't go outside. Don't go running. Don't go to the playgrounds. If you've got children, try to stay as isolated as possible. All right. So that's it for today. The most important takeaway point here is if you do have symptoms and you have respiratory distress, you must go to the ER as soon as possible. If you do not have respiratory distress, contact your doctor, your primary care provider. Figure out if you need to show up to go to their office, or if they can just give you some recommendations over the phone or over telemedicine. Do not just show up in your doctor's office. Don't leave the house unless you have to. I'll see you here tomorrow with some further updates. If you have questions, leave them below or send them to me. And I hope you have a great Wednesday. How do I stop? Oh, there we go.